As a plastic surgeon, especially as a facelift specialist, I cannot stress enough how crucial excellent visibility is during surgery. For example, when performing neck surgery, I aim to keep the incision under the chin as small as possible. When doing deep plane facelift or vertical dual plane facelift neck lifts, I carefully maneuver around delicate structures like the facial nerve branches and great auricular nerve. In all these cases, optimal visibility is essential for safe and successful surgery. But what can significantly reduce visibility? Continuous bleeding into the wound. Of course, every patient undergoes blood clotting tests, often weeks before surgery, to ensure there are no issues. If the results aren't within a safe range, I simply wouldn't proceed. However, despite normal test results, some patients still bleed excessively during surgery. This has happened to me a few times recently, which is why I wanted to make this video educate my patients. So why do some patients bleed more? Before making any incision, we inject solution under the skin of the face and neck. This mix contains saline to dilute the solution, lidocaine to reduce pain during a local anesthesia and limit IV pain medication during general anesthesia. And finally, very important, adrenaline to constrict small blood vessels and capillaries, reducing bleeding. In a well-prepared patient, this works effectively. Here you can see the area behind the ear we did just cut into and separated the skin from the underlying tissue. There's no bleeding. We call this a dry field, which provides optimal conditions for a safe procedure. Now let's look at a different case. As soon as I make the incision, blood starts seeping from the tissues immediately. It doesn't stop. It bleeds everywhere. This kind of diffuse bleeding is challenging to control. Even when I stop one area, another starts bleeding. It's time-consuming, requires advanced technical skills, and makes surgery far more complicated. In these cases, I have to consider whether I can safely complete a full extended face and neck lift, or if I should modify the plan. So no worries, this patient, despite the challenges, had a great surgical outcome. But the next morning, she was very bruised. Post-op bleeding risk was also much higher. When I asked her about it, she admitted that she had consumed alcohol the weekend before surgery. A big, big mistake. How can you prevent excessive bleeding? As a patient, you play a crucial role in ensuring a smooth surgery. Here's what you need to do. Stop drinking alcohol for at least 1 to 2 weeks before surgery. Avoid aspirin for at least 7 to 10 days before surgery. Don't take ibuprofen, naproxen, or diclofenac for at least 5 to 7 days. Pause anticoagulants as instructed by a prescribing doctor. Stop vitamin E at least 7 days before surgery. Avoid turmeric supplements. Stop taking ginkgo biloba, garlic, ginseng, ginger, and St. John's wort 7 days before surgery. Even reduce excessive caffeine intake 48 hours before surgery. Following these guidelines makes me a very happy surgeon and ensures you get the safest, smoothest, and most successful outcome possible.